afternoon. My name is Amra Marshall. I am a sophomore social work major, sociology minor from Rockford. Can we ask Rockford? Rockford, Illinois. Thank you very much. So awesome. Okay, so a couple of weeks ago, about 4 or 5 weeks ago, my lovely professor, Dr. Lucas, asked me to present research on intimate partner violence, and I remember thinking, can I do this? I don't know if I really want to, because it hit really close to home. About 10, 15 years ago, I lost both of my aunts to intimate partner violence. One at the hands of her current partner, and the other one due to the coping mechanisms of intimate partner violence. And so it was kind of hard just thinking why these women kind of stay in this relationship. And so I wanted to conduct research chronicling the information, just so the lives of my aunt Denise and my aunt Karen don't go in vain, along with the lives of other people. So I will get to my presentation. Okay. So what is intimate partner violence? Intimate partner violence is defined by many scholars as the physical, sexual, or psychological harm by a current or former partner or spouse. Now, with this information, I did find out during my research, excuse me, that intimate partner violence, or IPV, can occur between heterosexual or same-sex couples. The frequency and the severity can differ. It really ranges, and then also, sorry, I have some notes on my tablet here. Sorry, I'm a little nervous, guys. Also, it can occur in person or electronically, and then the IPD can lead to reproductive health systems as well as increased vulnerability to HIV. Now, I know many of us have heard about domestic violence, and so domestic violence and IPV have been used interchangeably. Domestic violence has been historically used to define abuse within one's household, while intimate partner violence is more broadly defined as physical, sexual, or psychological harm between a spouse or current partner. Yes. Okay, so selected risk factors or IPV for victims and perpetrators. So basically the risks for both the victims and the perpetrators are very similar, and they include an exposure to or being a victim of physical or psychological abuse, poverty-associated factors such as a lack of education or low education concludes my presentation, and I thank you for being so very attentive.
Hey, what's up now?
Brother, what's up?
This is a groovy party, man. I can dig it.